If I were to assess the last year since I had the procedure, it would be like every other day in my life. I mean, there was no change. I do everything that I've ever done. Lift weights, play football, do photo shoots, do movies, but nobody has ever once asked me if I had anything done.
So Clark, it's been over a year now.
I mean, it really flew by, and honestly, do you think you got what you were going after? I love it.
I look at this, there's absolutely no way anyone could ever tell you've had a transplant. You look completely natural. And that's the whole goal, is just to make you look like you were numerous years ago. What I did was put in about 20% density. Why is that the magic number? It's all about survival of the grafts. And if you wanted more density, this is the perfect time, after a year, to put in more grafts.
Is there any reason that I would think that these grafts would fall out in the future? They're going to stay permanent, they're there forever. So if one gets pulled out, I wrestle, I do jujitsu and all these sorts. If someone rubs my head into the mat and they rip out, will they grow back?
Okay, now let's talk about that, because that's an interesting point. When it comes to hair transplants, we have what's called donor dominance. I take this good genetic hair that grows forever, and I can put it anywhere on your body. I could put it on your nose, and it'll grow forever. The biggest risk for the transplant process is that first week, and we're trying to get the blood supply to the grafts. After the first week, the blood supply are to the grafts. Those grafts are going to grow for the rest of your life. And the only way you could, I tell patients they could screw it up is if you got scalped. And I don't think you're going to get scalped anytime soon.
You know, one thing I do want to mention is the fact when we looked at the photos of actually how you made my hairline, I saw how you drew that, and I compared it to a friend of mine who just had his done by a discount guy in the paper, like $1 a graft or something like that. And his was just like, you know, and perfectly straight line all the way around. He's a 50-something-year-old guy. It just didn't look right.
A hairline is a misnomer. It's not a line. It's very irregular. And if you create a line, it's going to catch your eye. There's a ton of foresight that goes into it, because I'm creating a painting that is not only going to be looked at today, but it's going to be looked at 20 years from now, 30 years from 40 years from now. And this painting, the canvas can grow on me. And so it's very important to have the foresight to create a picture today that's going to look good 20 years from now.
I have an uncle who had this done years ago when the procedure first came out, and they took plugs. I mean, literally, the term plugs doesn't apply anymore. It is a science, it is an art, it is a practice. He looked at my specific needs and created an art piece. I mean, I'm a bodybuilder, I work on my body, I mold my body to be the best I can get it. And when I met Dr. McAndrews, I saw him as a guy that took the same interest in his profession as I do in mine. On my initial consultation, you put that little scope on my head and showed me how few hairs I had. Could we compare it and I could see how many more I have now compared to then?
Absolutely.
That's amazing. I mean, I can't believe how thick. I mean, those look like ropes.
And so you can see here, the right is the good genetic hair that we took a year ago to put it up front. The left is the transplants with the existing thinning hair.
You know, I wanted to see the back for a reason, because when I look at the front, you can still see a little bit of scalp.
Yeah.
But now that I see the back in comparison to the front, I mean, honestly, I feel a whole lot better, even better than when I walked in originally.
Right.
So this, I mean, this is really good.
Yeah.
You know, the thing that I really loved about Dr. McAndrews is, first of all, he's just a guy's guy. He goes in and he actually spends time with you. He's not a guy that sends a salesperson in to talk to you. He's not there to sell you anything. He's really there to educate you on why or why not you should have this procedure done. Well, I'm so happy, honestly. I can't tell you how excited I am. And now that you mentioned that I can go ahead and get a few more, I'd like to set up that time now. So
Absolutely.
for the average guy, one procedure is probably enough. Well, I wanted a little bit more. And when I was taking some photos, I saw just still a little bit of thinning. I mean, there was definitely additional growth, but I wanted more. So I had an additional procedure. I'm about 2 months out from that right now. And in a year, I'll be completely done and all of this will be filled in. But here's the key. Dr. McAndrews and his staff are stellar. You walk in and Robin at the front desk is the most welcoming person that you'll ever find. And then you go back to the girls that are helping the doc with the procedure. There's no reason to be embarrassed. There's no reason to be shy or ashamed of what you got going on, because Dr. McAndrews has surrounded himself with what I believe to be the best staff available for a situation like this where a guy can be intimidated. Seriously, Doc, you're the best, man. Thank you very much.
You're very welcome.
Okay, all right, see you. So this can give you an understanding of why I made the choice to do this procedure. So now you got to decide for yourself why it's important for you. I mean, if somebody's looking for a legitimate doctor that is in this for all the right reasons, Dr. McAndrews is the guy.